taping. Okay, this is the patient assessment medical station, guys. Now when you come in, they're going to have some cards on the table. You will draw a card, which will tell you which scenario you will get. Today, I'm going to do the cardiac scenario. Just because I'm doing cardiac, don't just practice cardiac, guys. Practice all one
scenario.
I'll tell you. All right, let me read the instructions. Watch that you're not in the camera, blocking the camera. This station is designed to test your ability to perform a patient assessment of a patient with a chief complaint of a medical nature and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you're assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain your information. You may assume that you have 2 EMTs working with you and they are correctly carrying out the verbal treatments you indicate. You have 10 minutes to complete the station. Do you have any questions? At that point, you'll tell them whatever questions you have or no, and they say, okay, here's your scenario. You arrive on the scene where a 57-year-old male is complaining of chest pain. All right. So first thing I'm always going to do is, PSI, is my scene safe? I have one patient. The nature of illness apparently is cardiac. Okay? So I've got my nature of illness. I'm going to place ALS on standby. I'm going to form a general impression. It's not too good because according to this, he is pale and sweaty. He's grabbing his chest. Sir, did you fall and hit your head?
No.
Okay. I have considered C-spine immobilization and I don't need it. Yes, you have to say that. Sir, what happened today?
My chest really hurts. I have an angina, but it's worse than I've ever had before.
Okay. So, at this point in time, my patient is awake. His chief complaint is chest pain. He has an airway. I'm going to place him on 15 liters by a non-rebreather mask. My patient is breathing. What's his rate?
24 and shallow.
24 and shallow. Thank you, sir. Matter of fact, feed that to me as I'm asking for it. 24 and shallow. Okay. Pulse. I'm going to check radial pulse. What's the rate quality?
124 and weak.
124 and weak. Skin color, temperature, and condition.
Cooling, firing, no bleeding.
Okay, and as you said, no bleeding, I'm going to say I'm going to assess for bleeding. You have to assess for bleeding, people, even though it's a medical call. Okay, there's no bleeding. This patient is a high priority patient. I'm going to load him into the ambulance and we're going to do everything en route to the hospital. So my time is ticking. I'm already en route, right? So, start our sample history. Okay, sir. Can you tell me about the onset? How did this come about?
I was taking my afternoon nap and pain woke me up.
Okay, so pain woke you up at your afternoon nap. Can you tell me, does anything provoke it, make it better or worse?
It's nothing I can do to make it go away. It just hurts really, really bad.
Okay. Can you describe your pain, the quality of the pain?
It started out like indigestion, but then it's gotten worse. It feels like a big weight is pushing on my chest, and it's hard for me to breathe.
Okay, does the pain stay in one spot or does it spread out and radiate?
My shoulder and my jaw started hurting about 10 minutes before you came. But the pain was worse in the middle of my chest. That's why I called it.
Okay, on a scale of 1 to 10, 1 being almost no pain, 10 being the worst pain you ever felt in your life, can you tell me how bad the pain is?
It's the worst I've ever felt in my life.
And what time did all this start?
I've had this pain for about an hour, but it seems like it's been for days.
Okay, are you allergic to anything? Did you do any interventions? Have you done anything to help the pain?
I took my nitroglycerin about 15 minutes ago, but it didn't do anything.
Okay, so the nitro didn't
Am I
work.
having a heart attack?
I don't know yet. We'll find. We gotta get you to the hospital. All right, sir. Can you tell me, are you allergic to anything?
No, I don't have any.
Okay. Are you taking any medications aside from the nitro?
Just the nitro.
Just the nitro. Okay. What kind of medical problems do you have? Past medical history.
I have an angina.
Angina.
About 2 years.
Okay, when was the last time you ate?
I had a soup and salad in about 3 hours.
Okay, and what were the events that led up to this?
I was sleeping, the pain was there.
Okay, let's get some vital signs on you. I'm going to get blood pressure. What's my blood pressure?
144/92.
Okay, 144/92. Pulse rate?
124.
Okay, and respiratory?
24.
24. All right. We don't need a focus assessment on this, although I could check his lung sounds. No, I'm not going to in this case. Is this your nitro, sir?
Yeah.
Okay. At this point, I have his nitro. I'm going to call Med Control. Med Control, this is Earl. I'm on a basic level unit. I have a 57-year-old male complaining of chest pain radiating up to his jaw and to his shoulder. States the pain is the worst he's ever felt. He's taken 1 nitro prior to my arrival without relief. The vital signs were, what was my pressure? And yes, you can ask for it.
144/92.
144/92. Pulse rate was 124. Respirations were 24. He has no allergies. This is his nitro. It is within date. I'd like to assist the patient taking his nitro. At that point, Med Control is going to tell you to follow your protocols. They're always going to say that. All right, sir. What I'd like you to do, you can do it one of 2 ways. You can either put the nitro and tell him to put this under his tongue, or you can just hand him the bottle and say, "Sir, I want you to take this as you normally would." And he'll take it. He'll self-administer it. Okay, so he self-administers it. Did that help? No.
No.
Okay. At this point in time, we're going to continue transport. I will reassess my transport options, and he's still in bad shape. So we're going to continue transport. I'm going to do my ongoing where I will reassess my initial. I will reassess my vital signs. I'll get new vital signs after I have given him the nitro. I will consider giving him more nitro en route every 3 to 5 minutes, up to a max dose of 3. Or if the blood pressure falls below 100 systolic, I will stop. Or if the pain stops, I will stop. I will recheck my focus, which is none, and I am done with this station. And I know I forgot something. What did I forget at the end? I forgot one of the ongoing. Initial vital signs.
No, you didn't.
Intervention. No, I did. I got it all. All right, guys, that's medical. All right, you can cut it, Karen.